Hello guys, if you're new here, my name is Lillith Lodge and I am an escort based in Brisbane, Australia. Today's topic of conversation is erectile dysfunction. This has been on my to film list for quite a while, and I think this is a really important topic of conversation to have because I feel like there's a lot of men struggling with this that don't actually realize that is what is going on. It's just not something that is commonly spoken about. So let's get right into it. What is erectile dysfunction? It is not being able to get or maintain a hard-on floor set. It's really not uncommon for this to happen here or there as an occasional thing. If you're a man watching this being like, oh well, last week it wouldn't get hard. If it's an occasional thing, it's probably not erectile dysfunction. It's not uncommon for it to happen here or there. But if this is a repeat issue, that is when you need to go and seek help for it. It can actually be a sign of a much more serious health condition. That's why I really want to push that you need to go and see a medical professional. Obviously, I'm not a medical professional. I'm an escort. I have no real science background at all. I just know what I see in person when I encounter these clients. I think we may have a misunderstanding as a community about sexual arousal and like getting hard on, right? It is so much more than just seeing a hot chick, getting excited, hard on. There is so much more to that. It is like a connection between multiple different parts of your body. It's your mind and emotions. It's your hormones is a big thing, your nerves, your blood vessels, everything. So many elements have to come together to get him going, okay? It's not as simple as just see hot chick, get hard. And when you live with erectile dysfunction, a lot of the time you can start getting into your head and you start worrying more and more because it's not working. It just makes it worse and worse. It's like, oh my God, he's not working. I've just paid all this money to see a provider. It's not working. Oh my God, I've wasted my money. Can't it just get hard? It's a useless dick, all this sort of stuff. And you get into this really negative mindset. Erectile dysfunction can have a massive impact on somebody's life. It really can. And it is really hard to see. It is hard to see people struggling with this. And it's also really hard to see people struggling with it and not going and seeking help for it. Let's talk about some physical causes of erectile dysfunction, because as I said earlier in the video, a lot of the time this is a sign of an underlying serious health condition. It could be a sign of heart disease, clogged vessels, high cholesterol and blood pressure, diabetes, obesity, Parkinson's. It can also be the result of some prescription medications, sometimes smoking, a lot of alcohol consumption, drug use, surgeries that you've had, or just having low levels of testosterone. And some psychological conditions that may cause this are things like anxiety, depression, being incredibly nervous, so stress, genophobia, I think that's how it's pronounced, which is the fear of sex, often that causes a result of a traumatic life event, or having incredibly low self-esteem. This can often lead to this happening too. So what is actually causing your dick to not be able to get hard? There's a lot of things to this, and as I've said, I'm not a health professional, but there are multiple systems in your body that need to be working to get him to stay hard. The first being your circulatory system. This one's to do with your blood vessels, right? You need your blood vessels to be working to get blood to him. You have your nervous system, which is like your brain, your spinal cord, and all of your nerves, and they send electric impulses. They are how your body is able to move and feel. So if this is impacted, that's going to impact him as well. There's also the endocrine system, which refers to like your hormones. Your hormones are a really important part of holding and maintaining an erection. It's those hormones that signal to your body to perform certain actions, certain things like him getting hard and staying hard. Studies show that erectile dysfunction actually impacts 50% of men aged between 40 and 70. So this is way more common than we think it is. And there is still so much stigma around going and getting help for anything to do with sexual health. But if you think that this applies to you, I really advise that you go and see your GP about this. Now, as an escort who encounters clients with this issue, it can be really, really tricky from my point of view. It is not uncommon at all. I probably encounter this at least once a fortnight, if not more frequently. And unfortunately, there is not a lot I can do to fix the situation. Obviously, I can do my best to try to make sure that someone feels safe and comfortable and try to reduce stress levels and things like that, if that is what is impacting it. However, I am not a magic fairy and I can't just click my fingers and make it get and stay hard. That is outside of the realm of possibility for a provider. I will always do my best, but unfortunately, when we're talking about this, erectile dysfunction is not something that the provider can fix. And it really isn't beneficial to either of us for the client to become angry, frustrated, and start blaming the provider because they cannot get hard or they cannot maintain an erection. I have had many clients in my career lash out at me because their downstairs was not working, asking for things like refunds despite the fact that they have actually done part of the booking. I've had other clients tell me that it is the way that I look, or it is something that I have done is why their body is acting that way. And obviously I have quite a thorough understanding of this topic and like what erectile dysfunction is. And I'm well aware that it is not my fault when this stuff happens. But you may be lashing out at providers who genuinely feel that they have done something wrong, and you may be really, really upsetting them by doing that. It's not nice. If you're not able to hold and maintain that erection, there is nothing wrong with that, but it is not our fault, is what I'm trying to say. How can you fix it? I'm sure there's some of you watching this that are like, yep, that's me. How do I fix it? See your GP, firstly. Go and see your GP. I'm not a GP. You need to go and see a real GP to get an actual diagnosis. From there, there's a lot of things that they can do to help you, okay? One of those being medication. There are medications like Viagra, which I do encounter quite often doing my job. That's not uncommon for somebody to take that. There are also some types of medication that can be injected straight into the penis itself, which is very interesting to me. Exercise. This is a big one. I know half of you're like, oh, exercise is meant to fix everything. It does nothing. No, it does. Things like jogging, walking, cycling, that kind of exercise is really good for helping and managing with erectile dysfunction. Obviously, when it comes to things like smoking, drinking, drug use, those are tied to erectile dysfunction. So if you're struggling with this, letting go of those things may really help you as well. I know that is easier said than done. Maybe even consider seeing a therapist. There are sex therapists out there that can help with this kind of thing. I've actually never seen a sex therapist. I would be interested to at some point, so I can't really let you know how that is. But I think just having somebody to discuss these things with would be really beneficial. Now, when looking into this, I did not know this was an option, but I'm very intrigued by this. Apparently, there is something called penile low intensity shockwave therapy that you can have done to him to manage erectile dysfunction. This is really cool. If anybody has had this done, please let me know in the comments below, because I do find this topic very interesting. That is not something that I have ever had anyone speak to me about. I didn't know anything about it before researching for this video. However, the other two things on here, hello Tommy, have you come to say hello? The other two on here I have encountered. So there is a penis pump, which I have seen one of these before, and also a penile implant. Now the implant actually doesn't impact someone's ability to orgasm or finish, anything like that. It functions as normal. Oh, and of course there is like testosterone replacement therapy. If that is what the root cause of the issue is to do with your testosterone levels, that can be fixed as well. Pretty much to sign this off with Tommy, if you're watching this and you don't have erectile dysfunction, but you want to reduce your chances of encountering this later in life, or it happening to you, of course, exercise, cutting out smoking, drinking, drugs, that kind of thing. They say maintaining a healthy BMI. I don't really agree with the BMI system, as it can be pretty inaccurate, especially if you're quite muscular. I won't go off on a tangent about that. But just maintaining a healthy weight and a healthy lifestyle, and also getting a lot of good quality sleep. This is something I noticed a lot, particularly with my clients actually, is that they are so busy, they are not sleeping enough. You might want to watch that, because it's really important to make sure that you don't end up suffering with this later in life. So yes, I hope you guys have learned something. Of course, this is something that I do encounter on a regular basis as an escort. And it's not something that ever bothers me. It's not like I have any issue with seeing clients who struggle with erectile dysfunction. My only issue is when clients are projecting their anger with their own body and their own bodily functions onto myself, because it's really important to me that I try to give everyone the best experience that I can with me, and I never want to let anybody down. But I don't have magic powers and I can't fix it. This is completely out of my realm of ability to help you with this issue. I can try my best, but unfortunately I can't sort of wave a magic wand and be like hard. It's a lot more complex than that. So anyway, I hope you've learned something, and yeah, Tommy's waiting for Cyclone Alfred to hit. Are you scared? You don't seem scared, you seem fine. Oh, your ear is filthy, darling. That needs to be cleaned. Anyway, we're gonna go and clean Tommy's ear now.